So, good evening, Professor. Nice to have you here. And we would like to take your opinion about, a lot of talk has been going on about the HMOs or the human milk oligosaccharides in the breast milk. What is the latest about the updates or the relevant points as far as HMOs goes in breast milk?
Well, oligosaccharides in breast milk have been long completely neglected. We didn't know how to handle them. Only 30 years ago we could identify them chemically, and it took another 2 decades until the real clinical and preclinical research started up. What we know now is we have 150 to 200 in breast milk, and not all mothers have the same amount. There are mothers who have good genes, they can secrete everything. So this is good for the baby. There are other mothers who have the genes which don't allow them to secrete all of these oligosaccharides. So the level of oligosaccharides is lower in breast milk, and specific oligosaccharides like 2-fucosyl-lactose cannot be secreted. We know that oligosaccharides protect the infant. They are important for the development of the immune reaction. No overreaction, but adequate reaction. They make it much easier for the infant to react because they kill the bad bacteria and they really harvest.
So these are
bacteria.
Something which is specific to human milk. I mean, you don't find this sort of oligosaccharides in the cow's milk. So I think what is the science of incorporating them in the infant formulas to give the benefit to the babies who are not able to breastfeed?
Well, this is just at the beginning. There are only two or three well-designed randomized trials. One trial which followed up healthy infants until 12 months shows if you add fucosyl-lactose to infant formula, you find less upper airway infection, less lower respiratory tract infections. You find less antibiotic use, less antipyretic use. So this is something. This outcome was quite surprising because it was not expected. And it is always good to see 2 or 3 other studies confirming this.
So this is the future.
But certain oligosaccharides can already be synthesized, not only in the lab, but you can upscale this and have industrial production. And you could add it, for example, to human milk fortifiers.
So as of now, I think we have only 2 HMOs which have been added to the infant formulas.
At the present moment, yes. The fucosyl-lactose seems to be very important.
Thank you, Professor.